Some of the most common risk factors for breast cancer, of course, being female. Breast cancer does exist in males. It is just a very low percentage because there are more of the breast cells in females. So being female, first and foremost, the highest risk factor. Also, family history plays a large risk. Aside from that, smoking, obesity, alcohol consumption. There are also a few genetic risk factors that contribute to breast cancer.
How much does family history play in developing breast cancer?
Family history plays a large role in breast cancer, especially if it's a first-degree relative. And a first-degree relative would either be your mother, your sister, or one of your daughters. There are also some other genetic components to breast cancer that involves other cancers as well. So it's important for us to know your entire family history. Even, for instance, if your dad had colon cancer at a young age, anyone with stomach cancers, there are different genetic syndromes.
What lifestyle changes can help lower a woman's risk of breast cancer?
So the healthier your lifestyle, the better, just for your generalized health, but also to directly decrease your breast cancer risk. You know, certain characteristics and risk factors are not modifiable. You can't change your family history. But things that you can change are decreasing obesity, being at a healthy body weight, a healthy BMI, especially in women who are postmenopausal. It's also important to avoid alcohol and avoid smoking.
So, if you would, tell us more about the DHR Health's Breast Center of Excellence. How did you come to get that designation?
So being a breast cancer center of excellence is something that DHR is very proud of. It's something that I'm proud to be a part of. It means that our hospital submitted ourselves voluntarily to be looked at by committees to make sure that we were practicing the most standard of care evidence-based medicine, especially for breast cancer. It means that we can treat women from a wide range of subspecialties within our own hospital system. So being a breast cancer center of excellence is something that we are incredibly proud of. It's something that I'm proud to be a part of. We're the only breast cancer center of excellence south of San Antonio. We are able to provide our patients with a vast variety of cancer care, all within our own roof. From surgeons to medical oncologists to radiation oncologists, radiologists. We are able to do that all for our patients here and refer within our own hospital system so we can all share our notes. We can share the imaging. We can share all pathology results.
And Dr. Kroenke, no one ever wants to hear the words, you have breast cancer. But for 1 in 8 women, this is a reality. From your perspective, what do patients need most in those first moments after receiving a diagnosis?
Yes, unfortunately, this is a large reality. 1 in 8 is approximately 12%. Most people who think about it, someone's life that you know has been touched by breast cancer. After receiving a diagnosis, what patients need is reassurance. They also just need, time to process the diagnosis. It's difficult to hear. First and foremost, I reassure my patients that no matter what the outcome is, we are going to get them through this. Most cancers these days are rapidly treatable, and we are able to get them not only to treatment, but to a cure. And that's the most important part.
At what age should women begin regular breast cancer screenings?
Women who are of average risk, meaning you have no first-degree relatives with breast cancer, you have no genetic syndromes, should be screened starting at the age of 40 years old. And my recommendation is to be screened every year with a mammogram.
And what about those that have got a family history?
So if you have a very strong family history, especially in someone who has a first-degree relative who has been diagnosed before the age of 40, mammograms should start a little bit sooner. You can also be screened with MRIs and ultrasounds. It's important to talk to your physician, so we can also do things like genetic testing to determine your exact personal risk and if there's anything we can do to decrease your risk.
How often should women perform self-breast exams, and how effective are they?
So self-breast exams in the last few years have been kind of a topic of great debate. Some organizations actually recommend against performing self-breast exams as they feel that most women don't understand what is a concerning palpation something that you feel or something that's normal breast tissue? For me, what I really stress to my patients is knowing your own body, being what I call, breast aware, knowing what your regular breast feels like and knowing what it looks like in front of the mirror, different arm exercises to make sure that if something rapidly changes, you're aware of that.
DHR Health is having a special on 3D tomomammograms. What is this?
So a 3D mammogram is a mammogram that is slightly more intensive from a technology standpoint than a regular 2D mammogram. It actually puts the mammogram together in a series of very small, what we call slices in the radiology world, to give us almost a movie and a very good picture going through all of the different layers of the breast tissue instead of one static image. At DHR Health in the month of October, we are doing a special with $99 3D mammograms. You do need a doctor's referral because we want to make sure that your results are being followed up on. But at any point during the month of July, if women call, they just need to state that they know about the mammogram special to get that price.
Okay. What signs or symptoms should prompt someone to see a doctor right away?
Of course. So again, I believe every woman should know their own breast. That way they can tell when changes happen. If you are having any nipple discharge, especially from one side, not both sides together, if you notice that you have a new mass that is usually firm, something that you can see that looks different, if your skin has become thickened or red or dimpling, those are all very worrisome signs and you should see your physician immediately.
Well, those are all the questions I have. So are there any other final remarks on Breast Cancer Awareness Month or DHR Health's Center for Excellence?
So, I love the month of October and I love that it's breast cancer awareness, but I think it's very important that breast cancer cannot be just 1 month out of the entire year. 12% of women will be affected by breast cancer. So it's something that every woman should have in the back of her mind, not just 1 month. So I just really want to share my support for those women who are in their fight against cancer right now. I want to give my prayers and my hope to those who are waiting on a diagnosis, and my thoughts to the family who have lost anyone from breast cancer. I'm very thankful to be at DHR Health. I'm happy to be helping this exact patient population and serving this community. So any patient we can help, I'm here.